This is the storyteller with a hot topic. How long does depression from anesthesia last? Anesthesia. Some symptoms overlap, such as fatigue and irritability, but post-op depression is persistent, lasting longer than 2 weeks after your surgery. They don't tell you that. If left untreated, it can go on for months. Surprisingly, feelings of hopelessness can persist even when a patient had a successful surgery and is on their way to full recovery. Why does anesthesia make you sad and leave you depressed and in a bad mental funk? Because there is a medication called sevoflurane. This is a gas that we use commonly to keep patients asleep. There's some increased incidence of crying when that medication is used, unbeknownst to the patient, of course. The stress of surgery combined with medications and feeling slightly disoriented? No, it's no joke. And no, it is not in your mind. This is real. What's happening to you is real. The way you feel is real. And yes, you need to relax and take caution and not think you're losing your mind. You just need to detox. Let that medication get out of your system. On January 23rd, 2023, I severed my radial artery and I am in recovery. Today is February 1st, 2023, so this was just last week. And I was having some postpartum depression, and it's really horrible the way that the anesthesia leaves you feeling, and it's even more horrible if you don't know that it's not you. It is the anesthesia. And now you know why you feel the way that you do. So no, you're not tripping. No, you're not losing your mind. And I pray that you will find a way to detox. Herbal teas is what I take. And I'm going to tell you something right now. Once you find out what the monster is, all you can do is try to get rid of it. Can anesthesia make you feel weird for days? The long answer is, this is precisely what you want when you're having an evasive or painful procedure. However, some people suffer lingering effects in the days after, and my answer is a big fat yes. And I had to do a lot of research to understand what was going on with me because I thought I was losing my mind. And I know I'm not the only one. So, you are not alone in what you're feeling because it is real what you're feeling. Now, here's the knowledge. Anesthesia holds long-lasting side effects. Some people may not have any effects at all. Others might. And if you are, no, you're not tripping. No, you're not losing your mind. Yes, anesthesia can leave you with bad side effects after anesthesia has been administered. I am one of them. These include drowsiness and slowed reaction times, difficulty concentrating, remembering new information, processing information, and finishing complex tasks. How does anesthesia affect mental health? I am not a doctor. I am not a medical professional. I am a patient that had surgery and was administered anesthesia. This is what happened to me. And the research that I found, I'm giving it to you. And all of you that have had to have anesthesia, at some point, you will have some side effects. And if you don't have any side effects, praise Jesus. If you do, it's not in your mind. I'm going to tell you, for me, it has affected every core of my being. On the post-operative mental status of patients, among surgeons, they say anesthesia may be responsible for post-operative delirium, confusion, hallucinations, depression, mania, and even psychotic behavior. How long does it take to feel normal after surgery? My guess would be it depends on the person, but for me, like I said, any symptoms that you could possibly have, any abnormal side effects, I'm your huckleberry when it comes to side effects from medication because I don't do medications. I'm a naturalist and I use herbs and I figure there's something on this earth for everything. And as a matter of fact, if I would have had my way, I would have had that surgery wide awake, but the anesthesiologist wasn't having it. However, after surgery, you may need to recover for 2 to 3 weeks or longer, depending on the procedure. Even if you start to feel better, don't jump back into your old activities at your former pace. Follow your healthcare team's advice for how long you need to take it easy. No, you are not crazy. There is something wrong. You are suffering from the side effects of anesthesia. Depression is a side effect of anesthesia. General anesthesia has a real physical impact on brain functioning. That's why it works. Great for surgery, but that is why it also carries the risk of depression following surgery. Take it easy, and remember, you are not losing your mind. Your mind has been breached. God bless you in your recovery. In Jesus' name, stay strong. This is the Storyteller with another hot topic. Subscribe to keep up to date.